Many parents often ask the pediatrician after the birth of their child, "Why is that ointment in my baby's eyes?" Well, it's to prevent eye infections that happen in the first 4 weeks of life. And it's actually quite common, happening in 1 to 12% of all newborns. These eye infections, or otherwise called neonatal conjunctivitis or neonatal ophthalmia, are a form of bacterial infection of the eye contracted by newborns during the passageway through the birth canal of an infected mother. Many parents may be saying, "Well, I don't have an infection. Why does my baby need to get this ointment?" Well, most of these infections actually happen in babies whose mothers didn't think they had any type of infection. The term actually refers to any conjunctivitis or eye infection in this age group, irrespective of the cause. The great thing is the rates of ophthalmia, or the two most common pathogens, have actually declined over the past 2 decades as a result of the decreasing prevalence in the population of these two common bacteria, as well as better screening for them. Most kids actually just get a mild illness if they do contract this. The exception is the eye infection due to an infection with gonorrhea. Without preventative measures, this bacteria can occur in almost half of infants exposed during delivery, and unfortunately, it often leads to blindness. Despite the decreasing prevalence of gonorrhea in our countries, especially in developed countries, it still occurs quite frequently in North America and westernized countries. So, as a result, most health agencies recommend that, as soon as possible after birth, all agents receive prophylaxis with one of 3 compounds, most commonly called silver nitrate, tetracycline, or erythromycin, to help reduce the risk of complications of this conjunctivitis. These agents have proved to be a benefit, not only against these most common 2 causes of the eye infections, but also many other organisms, effectively preventing blindness from these causes.